Today's medication unboxing and over-the-counter review is going to be the medication Ibuprofen.
Ibuprofen. Ibuprofen?
Ibuprofen.
All right, so I am fascinated by the history of ibuprofen. Now, you cannot fully understand the history, which is relatively short, of ibuprofen, right? We're talking the 1950s. But you cannot understand the true importance of ibuprofen without understanding aspirin. Now, aspirin goes way back, all right? We're talking ancient Greek and Chinese healers. Egyptian Pharisees are also known to have used aspirin. Now, at that time, they didn't know they were using aspirin. Okay, that wasn't discovered later. But they were instructing their patients, their family members, and the people they were taking care of to chew on the bark of the willow tree. Various types of willow trees. They were told to chew on it because they found that by chewing on that bark, right, not willow, but willow trees, they were told by chewing on those that their pain would be reduced, their fever would be reduced. So these Egyptian, Greek, and Chinese healers, man, they knew what was going on. So they would treat these people with these willow, basically willow jerky sticks.
Step into a Slim Jim. Oh, yeah.
But again, they didn't know what it was about the willow bark that gave it these properties, right? So in the year 1820, a German chemist, he isolated what he thought was the component that gave willow bark its power, its strength, its medicinal effectiveness, and that was salicin. He was looking for an answer because he had a father, and his father had severe rheumatoid arthritis. Aspirin had been used for rheumatoid arthritis and pains for, like I said before, millennia. The problem with his father had extremely bad GI or gastrointestinal side effects. He developed ulcers and had cramps, nausea, vomiting, severe belly pain because of taking the medication to treat his rheumatoid arthritis. And that is a problem that persists today. Okay, it is often said that medications sometimes are just controlled poisons. And sometimes that is right. We are trying to treat one thing, but sometimes it has side effects more in some people than others. So he was determined to help his father. Man, there ain't nothing like a son's love for their father. Okay, so he was determined to find something that worked. And he happened to have the skill set to give him the best shot on doing that. And so he set out and he wanted to find a medication that had the salicin component to it, but didn't have the gastric side effects. He put it through a process called acetylation. He turned this unstable, unsafe, high side effect profile drug that was found in willow bark, and he turned it through acetylation into salicylic acid. Okay, and then he called it aspirin. A for the acetyl component, spirin for the spirea plant that he was able to harbor this salicin from. And that gave us aspirin. So we had a notch improvement. It was improved, but still side effects. So in 1953, a chemist and a pharmacist, man, they tag team. They wanted to develop a drug that had less GI side effects than the previously treatment of aspirin, which had become the world's gold standard for rheumatoid arthritis. 1969, they came out with studies showing that it was just as effective as aspirin without the GI side effects. Bam! Victory for science! Okay? Then a few years later, they found out that it could be used for other pain. Then in 1983, passed it as over-the-counter pain and fever medication. And then 1985,
1 year after me coming into this wonderful world and Michael Jordan's second year in the NBA. What a good year.
brought us to my favorite part, when a trademark high-priced drug becomes generic.
All right, knowledge recap. Okay, so you have thousands of years of people treating pain with willow bark, but had side effects. So, guy who loved his father, who had some achy bones and some arthritis with an RA in front of it, okay, he wanted to help him out because he loved him. He's got a big heart for his papa, okay? He makes a better drug, but then that drug still has some side effects. So two big old brainiacs, they said, hey, let's see if we can do this better. Let's build a bigger and better mousetrap. Boom, Ibuprofen. Let's get back to it.
So let's take a look at our tablet form right here. And you'll notice an I-2. Most medications that you will take over the counter has what's called an imprint number. This is basically a license plate or a barcode. It is what allows the FDA to monitor and regulate the production and storage and basically accountability of the drugs produced. Here you can see the imprinted number on the capsule form of ibuprofen. A lot of people harp on the regulations of drugs, right? Most countries throughout the developed world have some organizations that regulate the development, the research, the safety of drugs, right? Had there existed something like that in the past, Ludwig van Beethoven may still be with us.
Wait, what? Tell me more.
It is thought that aspirin overdosing on too many willow branches was the cause of his acute renal failure. Okay, renal meaning kidney. Okay, this aspirin or willow bark killed one of the world's most prolific composers.
Ba 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 ba. Knowledge drop.
So we'll check out the tablets here. These are 200 milligrams. I've switched over to a 15 blade scalpel. It has more of a rounded edge. And so I'm just scraping off the enteric coating. And the enteric coating, as we discussed in our Tylenol one, this is just, and it prevents the early breakdown of the medication. And so, because most of these medications are going to be absorbed in the proximal small intestines, and the stomach doesn't want to be irritated by it.
Ibuprofen is a class of NSAID, okay? Which is a non-steroidal anti-inflammatory drug, okay? Now, that's ibuprofen. Now, how ibuprofen is, it works on what's called a COX, okay, which is the cyclooxygenase enzyme. Okay, it's COX-1 and COX-2. Now, when we talk about enzymes, we talk about basically a protein, okay, that has a function. These are produced by what's called arachidonic acid. Okay, so then arachidonic acid activates arachidonic acid then leads to the COX-1 and the COX-2 pathway. Now, COX-1 and COX-2 both have effects over fever, pain, inflammation.
So anybody who's new might be wondering, what on earth is he doing with the Sierra Mist? What's fantastic is that Sierra Mist found in my local hospital is equal to the pH or the acidity of the stomach. So we're trying to mimic the breakdown of this drug in the stomach.
So ibuprofen and other known NSAIDs, what they do is they karate block this effect. They treat fever, they treat pain and inflammation by stopping and putting a roadblock in that pathway. So these enzymes can't perform their function. They can't cause fever, pain, and inflammation, which then helps us to say, wow.
Now, ibuprofen is considered a rapid onset, okay? Its effects being felt within 30 minutes, and the expected duration of its analgesic and antipyretic effects being able to hold within 4 to 6 hours, okay? It is absorbed through the soft tissue mucosa. It is metabolized in the liver, okay? Meaning that when metabolized means broken down into both useful and trash parts, okay? The useful part are used by the body, then the trash parts that are metabolized through the liver are then excreted through your feces, okay? And your urine eventually. The peak plasma time for ibuprofen is almost 50 minutes to 2 hours. Now remember the peak plasma point at which that medication reaches its highest level of concentration within the blood. Now again, this conversation and this educational film is not an all-encompassing review of this medication. There are some significant contraindications, meaning those are big uh-uh-ohs in taking ibuprofen, okay? If you have any questions about how to take your ibuprofen, you need to go talk to your primary care provider or your pharmacist, okay, to ask all these questions in detail. I am not your physician, although I would love to be. Hope you've enjoyed it. This is over-the-counter medication unboxing with Dr. Darren. Hope you had a great day. All right, peace. Knuckles, noggin, butterfly kisses, squid fingers.